Good day, this is Dr. Mai Sorcedo on the AGHS Health Services, and I'll be talking on the COVID-19 vaccine updates. Why should you get the COVID-19 vaccine? On the WHO dashboard, there have been 120 million cases confirmed globally, and there has been 640,000 confirmed cases in the Philippines, and the numbers has been increasing now. But there's more win in COVID-19 vaccine. It protects you and those around you from getting sick. It provides additional protection on top of the COVID-19 preventive measures. It may save lives, improve quality of life, and enable economic recovery. Who then cannot receive the COVID-19 vaccine? Yung mga ages 18 pababa, yung mga may severe allergy after yung first dose nila ng COVID vaccine, at yung mga may allergy sa vaccine component katulad ng polysorbate, polyethylene glycol. Meron naman yung mga conditional group na dapat may i-fulfill mo ng conditions bago sila pwede bigyan. Katulad yung mga na-expose sa COVID-19 patient noong nakaraang 14 days. Yung mga na-treat na COVID-19 patients noong nakaraang 90 days. At yung may alinman sa mga sintomas ng COVID-19 nung sa time ng pagbabakuna. So, hindi rin pwede yung mga first trimester ng pregnancy. After which, pagpa-clear sila sa OB-GYN nila, pwede na silang mabigyan. Hindi rin pwede bigyan yung recipients ng plasma or monoclonal antibodies nung nakaraang 90 days. Hindi rin pwede bigyan muna yung mga nakatanggap ng bakuna in the past 14 days. Ito naman yung mga kailangan ng medical clearance galing sa doktor nila. Yung mga may autoimmune disease, HIV patients, cancer patients, yung mga nag-organ transplant, o yung mga naka-steroids na pangmatagalan, at saka yung mga bedridden na pasyente. So ito yung mga pwede makatanggap ng bakuna. Or pwede, baka kailangan nila extra care. Kasi sila yung mga may bleeding disorder na umiinom currently ng anticoagulants. Yung mga may history of anaphylaxis or severe allergies. O kaya yung mga allergy to food, eggs, or medicine. At yung mga may asthma. Pero pwede yung mga may comorbidities like diabetes, hypertension, high cholesterol, G6PD, or undergoing dialysis. Now, where to get the vaccine? The vaccine is not mandatory. It's your choice whether to receive or not to receive the vaccine. But the public is encouraged to get vaccinated and be protected against the preventable disease. The national government will vaccinate based on the prioritization list and the vaccine delivery schedule. The government is continuing negotiations to ensure the adequate vaccine supply for all Filipinos, including those not in the priority groups. So you can get your vaccines from your LGU. At present, one cannot purchase COVID-19 vaccines from private clinics or pharmacies. Only the government is duly authorized to procure and administer vaccines. So this is the prioritization list of the NITAD. So they go first with the A group, then the B, then the C. So for those receiving the COVID-19 vaccine, you do not need to get tested before receiving the COVID-19 vaccine. For most people, it's not recommended to avoid, discontinue, or delay medications for underlying medical conditions around the time that you're to receive the COVID-19 vaccine. It is also not recommended to take over-the-counter medicines such as ibuprofen, aspirin, paracetamol before vaccination for the purpose of trying to prevent vaccine-related side effects. Now, in the vaccination area, You only need to wear your face mask, shield, and stay at least 1 meter away from others when you get vaccinated. Screening before being vaccinated should be done, and you remember to tell your vaccination provider all their medical conditions. You should also receive a paper or electronic version of a fact sheet that tells you more about the specific COVID-19 vaccine that you are being offered, after which you are to sign an informed consent. You should receive a vaccination card that tells you what COVID vaccine you received, the date and the place you received it, and when your second dose will be. You should receive instructions on where to report post-vaccination monitoring evaluation. So after receiving the vaccine, patients should be observed for at least 30 minutes after vaccination for any reactions. If you develop respiratory symptoms after vaccination, which is unlikely due to the vaccine, you need to get a COVID-19 RT-PCR test ASAP. Call your provider if any discomfort, side effects, or unusual symptoms persist 24 hours after getting the vaccine. You can also report your symptoms through the following links. But it takes time for your body to build protection after any vaccination. People are considered fully vaccinated only 2 weeks after their second dose of the COVID-19 vaccine. So the side effects of the COVID-19 vaccine: you may or may not have a reaction, but if you do get an adverse reaction, this can be managed. It could either be the common local symptoms like pain, redness, and swelling, or the common systemic symptoms like headache, fatigue, fever and chills, or muscle pain and tiredness, for which paracetamol, pain reliever, taking plenty of fluids, and cold compress to the injection site may be applied. For those that are less common, this may be an allergy, so only one of the following may be seen: the hives or swelling, coughing or sneezing, or itchy nose or itchy and red eyes, for which you can take anti-allergy medications, and then you continue your maintenance medicine for asthma and allergic rhinitis. For the rare cases, this may be anaphylaxis, when you have two or more of the following: hives, swelling, coughing, sneezing, vomiting or stomach ache, or fainting or low blood pressure, choking, or difficulty of breathing, for which your doctor can give you epinephrine (IM). So what may change after vaccination? You can gather indoors with fully vaccinated people without wearing a mask. You can gather indoors with unvaccinated people from one other household without masks unless any of those people or anyone they live with has an increased risk for severe illness from COVID-19. If you've been around someone who has COVID-19, you do not need to stay away from others or get tested unless you have symptoms. But what hasn't changed after vaccination? You still have to take steps to protect yourselves and in others in many situations, like wearing a mask, staying 6 feet apart from others, or avoiding crowds or poorly ventilated spaces. You should still avoid medium or large size gatherings. Delay domestic and international travel. And if you do, you have to follow prescribed requirements and recommendations. You have to watch out for symptoms of COVID-19, especially if you've been around someone who's sick. If you have symptoms, you should get yourself tested or stay home and away from others. And you have to follow guidance at your workplace if you ever go to work face to face. So what do we know? We know that COVID-19 vaccines are effective at preventing COVID-19 disease, especially severe illness and death. We know that other prevention steps help stop the spread of COVID-19, and that these steps are still important even as vaccines are being distributed. What we're still learning is that the effect or how effective the vaccines are against the variants of the virus that causes COVID-19. Early data shows that the vaccines may work against some variants but could be less effective against others. We're still learning how well COVID-19 vaccines keep people from spreading the disease. We're still learning how long the vaccine can protect us. With the current increasing trend of COVID-19 cases here in the Philippines, we know that they appear in clusters. There have been a new variant discovered here, the P3, but we know that the biggest factor is the laxity in our precautionary measure. So we still follow the apat dapat or maaring tatlo ay sapat. A for air circulation and ventilation, which is important. Maintain physical distancing 1 meter or more. Always use face mask and face shield properly. And the time of interaction should be less than 30 minutes. What gives us hope is that we know now how to take care of COVID-19 patients better. We're able to detect variants and keep track of them. And we know that the combination of face mask and face shield is more than 90% effective if used properly. So I would say that the best COVID vaccine is the one that becomes available to you and the one finally on your arm. These are my references. And we hope that you learn something new about the COVID-19 and its vaccines. Thank you.